Fluconazole is an antifungal medication used for a number of fungal infections. This includes candidiasis, blastomycosis, coccidioidomycosis, cryptococcosis, histoplasmosis, dermatophytosis, and pityriasis versicolor. It is also used to prevent candidiasis in those who are at high risk, such as following organ transplantation, low birth weight babies, and those with low blood neutrophil counts. It is given either by mouth or by injection into a vein. Common side effects include vomiting, diarrhea, rash, and increased liver enzymes. Serious side effects may include liver problems, QT prolongation, and seizures. During pregnancy, it may increase the risk of miscarriage, while large doses may cause birth defects. Fluconazole is in the azole antifungal family of medication. It is believed to work by affecting the fungal cellular membrane. Fluconazole was patented in 1981 and came into commercial use in 1988. It is on the World Health Organization's list of essential medicines. Fluconazole is available as a generic medication. In 2018, it was the 152nd most commonly prescribed medication in the United States. With more than 4 million prescriptions, Fluconazole is a first-generation triazole antifungal medication. It differs from earlier azole antifungals in that its structure contains a triazole ring instead of an imidazole ring. While the imidazole antifungals are mainly used topically, fluconazole and certain other triazole antifungals are preferred when systemic treatment is required because of their improved safety and predictable absorption when administered orally. Fluconazole's spectrum of activity includes most Candida species, Cryptococcus neoformans, some dimorphic fungi, and dermatophytes, among others. Common uses include fungal resistance to drugs in the azole class tends to occur gradually over the course of prolonged drug therapy, resulting in clinical failure in immunocompromised patients. In C. albicans, resistance occurs by way of mutations in the ERG11 gene, which codes for 14-alpha-demethylase. These mutations prevent the azole drug from binding, while still allowing binding of the enzyme's natural substrate, lanosterol. Development of resistance to one azole in this way will confer resistance to all drugs in the class. Another resistance mechanism employed by both C. albicans and C. glubrita is increasing the rate of efflux of the azole drug from the cell by both ATP binding cassette and major facilitator superfamily transporters. Other gene mutations are also known to contribute to development of resistance. C. glubrita develops resistance by upregulating CDR genes, and resistance in C. crasea is mediated by reduced sensitivity of the target enzyme to inhibition by the agent. The full spectrum of fungal susceptibility and resistance to fluconazole can be found in the TOKUE's product data sheet. According to the United States Centers for Disease Control, fluconazole resistance among Candida strains in the US is about 7%. Fluconazole is contraindicated in patients who adverse drug reactions associated with fluconazole therapy include, if taken during pregnancy, it may result in harm. These cases of harm, however, were only in women who took large doses for most of the first trimester. Fluconazole is secreted in human milk at concentrations similar to plasma. Therefore, the use of fluconazole in lactating mothers is not recommended. Fluconazole therapy has been associated with QT interval prolongation, which may lead to serious cardiac arrhythmias. Thus, it is used with caution in patients with risk factors for prolonged QT interval, such as electrolyte imbalance or use of other drugs that may prolong the QT interval. Fluconazole has also rarely been associated with severe or lethal hepatotoxicity, so liver function tests are usually performed regularly during prolonged fluconazole therapy. In addition, it is used with caution in patients with pre-existing liver disease. Some people are allergic to azoles, so those allergic to other azole drugs might be allergic to fluconazole. That is, some azole drugs have adverse side effects. Some azole drugs may disrupt estrogen production in pregnancy, affecting pregnancy outcome. Fluconazole taken at low doses is in FDA pregnancy category C. However, high doses have been associated with a rare and distinct set of birth defects in infants. If taken at these doses, the pregnancy category is changed from category C to category D. Pregnancy category D means there is positive evidence of human fetal risk based on human data. In some cases, the potential benefits from use of the drug in pregnant women with serious or life-threatening conditions may be acceptable despite its risks. Fluconazole should not be taken during pregnancy or if one could become pregnant during treatment without first consulting a doctor. Oral fluconazole is not associated with a significantly increased risk of birth defects overall, although it does increase the odds ratio of tetralog